Everyone has food stories. Many of our most vivid memories are linked to food because food is multisensory. There's a taste component, there's a smell component, there's a visual component. Every family uses food in a different way to communicate or to spend time together or to show love to each other. It's just viscerally ingrained in the culture of who we are. I started cooking with my grandmother when I was 3, way too young to be near knives. But she would sit me on the counter and I would tear parsley that she would put in the pasta, or she would have me mix the pancake batter. So I think my love for cooking and for food and my appreciation for it came most from her. There are both negative and positive experiences that people have with food's impact on health. I was 11, 12, and I started having really terrible gastrointestinal issues. We ran a bunch of tests, all the tests came back negative, and so we started, playing around with the elimination of different foods. I was losing weight, I was missing days of school, and so my pediatrician at some point suggested that I should start drinking these protein shakes. And they were whole milk based, and they made things worse. And that is how we figured out that I was just severely lactose intolerant. 6 in 10 Americans are dealing with at least one chronic diet-related condition, and 40% of us are dealing with multiple. I wanted to be able to translate all of the things that I had learned through my own journey into a tool that other people could use and not have to spend 30 years learning about food to figure out what's going to work for them. So that's how I ended up here, and that's why I decided to build bitewell. Our mission at bitewell is to improve the world's health through food. When you talk to someone who has been diagnosed with a diet-related disease, the experience is almost exactly the same. Your doctor says, hey, you now have this condition, I'm gonna write you a prescription, and you need to make some lifestyle changes, and then come back in a year and we'll retest you. That sucks. What are you supposed to do with that? What if in that moment, when you sit down with your primary care provider, you not only get handed a pharmaceutical prescription, but you also get handed access to bitewell's food pharmacy?
The digital food pharmacy is a personalized marketplace that offers guidance to help people understand what foods are best suited to their health conditions or goals. And it supports about 30 plus conditions right now and a vast variety of dietary needs, restrictions, and allergens.
When people start becoming interested in food as medicine for the first time, the first thing that most people try to do is understand a nutrition facts panel. The first action is helping people to better understand that without needing a master's degree. We've done that by creating this proprietary scoring system, the Food Health Score.
The Food Health Score is completely personalized to our users. So what that means is what's a 4 for you could be a 6 for me. And that blanketed health score, that static health score that exists with many other organizations out there, doesn't necessarily speak to the unique needs of our bodies and our health conditions.
The second action, I'm not in control of, but I hope to be able to influence the actual quality of the food on our shelves and the food that we put into our bodies. I'll give you a couple of examples. If you take a box of pasta off the shelf at the grocery store and flip it over, that box of pasta probably has something like 15 ingredients. If that same brand, you grab that pasta off the shelf in Italy or in Spain and flip it over, there's 3 ingredients. Why? Why are our standards here lower than they are in other countries? Let's at least hold the same standards that the rest of the world holds for what food we should put into our body. The second example is produce. Most of the lettuce in the US, as an example, is grown in California and in Arizona. By the time it gets from the grocery store in New Jersey onto my plate, it only has somewhere between 20 and 30% of its nutrient content. What if we focused on eating produce that was in season? What if we focused on eating produce that was near us? Would vastly improve the nutrient density of the same lettuce that you were going to pick up at the grocery store anyway.
Financial incentives also yield massive levels of adoption and engagement. So Making the healthy choice also yields less expensive products than it would if you were just shopping at a Whole Foods or natural grocers. So working with those companies to get the budgets for rewards and incentives oftentimes yield massive engagement and adoption results for us.
So what we have been pulling forward is this idea that food as medicine should be part of your overall benefits package in the same way that medical, dental, and vision are, in the same way that getting a gym membership reimbursed. If you're getting a gym membership reimbursement, why are we not covering food as medicine solutions? The two things go so hand in hand. And so that's what we're doing. And that's why we're incredibly excited and honored to be working with partners like ShareCare, who can help to bring our food as medicine solution to millions.
ShareCare helps manage the health and wellness of our members. So we offer a full ecosystem that drives a 360-degree seamless view of your overarching health. So whether it's a condition managing a chronic healthcare need, or they're just looking to find the right doctor or understand overall healthcare risks, we have tools and services available through our self-guided tools, as well as our high-touch programs to connect members to care in a way that's easy for them to understand, but also meets their lifestyle. One area of our services that I'm particularly proud of is our behavioral health solution called Eat Right Now, because it's an award-winning, evidence-based program that really breaks up the culture of dieting and helps people still lose weight. And so it's actually really backed with this science-based research around neuroscience and how our minds actually use subconscious triggers to help us manage cravings and cues and clues around healthy eating. How we eat and our relationship to food stems back to things all the way from when we were a child. So understanding the cues and clues around food and how you eat to help you manage those cravings and reset your relationships with food has been proven to help people who are looking to manage their weight or just mindfully eat. For so long, nutrition has been focused on education. And while that's the right place to start, we're really excited about the partnership with bitewell because it brings the connected thread between the education and action.
It is possible to manage medical conditions with food and healthy lifestyle. How does food impact somebody who has diabetes? What we eat has a direct impact on blood glucose, and blood glucose is something that it's a fuel for our body. A person with diabetes eats something and it is not effectively converted into the blood glucose, and it stays in the system for a longer amount of time, and it causes elevated blood glucose. If we consume food that will not increase blood glucose that much, the blood glucose is not going to go much higher, so it literally means food is medicine. Personalized nutrition is part of our usual care. We have it in the form of a conversation, so it's always a process of shared decision making. Eventually, that person with diabetes is in a driving seat, and I'm there as a clinician to guide their choices and the journey, but ultimately, it has to fit into their lifestyle and their preferences.
When you hear stories of people who were eating all of the wrong things, weren't able to get out of bed in the morning, had brain fog, weren't able to get out and be physically active, and you hear them talk about the transformation that happens to them when they start fueling their body in the right way, if we can help just one person do that, I'll feel like I've done my job.
So you're going to be cooking today, right?
I am, yeah.
What are you going to be preparing?
I'm going to make a fresh tomato kind of marinara sauce with pasta, but lupini bean pasta as opposed to your regular semolina flour pasta. Some more protein. Yeah.
It tastes good.
Tastes great.
Yeah, it tastes great.
Tastes great. I love pasta.